So what seems to be the problem today?
I have a cough and shortness of breath.
Have you been tested for COVID-19?
I've tested negative twice since the symptoms started about a week ago.
Do you feel like your cough is productive or dry?
I don't know what's productive.
When you cough, do you cough up sputum or like a goo?
Oh yeah, productive then I guess.
Okay, let's get you an x-ray and a blood test, and we'll also test some of the sputum you're coughing up. And we're back. Your x-ray shows that you have peribronchovascular infiltrate in your lungs, which is a pus-like residue and is indicative of some kind of infection. Also, your blood tests show an elevated eosinophil count, which would indicate the presence of a parasite, and your sputum has parasite eggs in it. Yeah, I know, right? Crazy. Anyway, it looks like you have paragonomyces, which is caused by Paragonomus trematodes in your lung, which weirdly enough is actually pretty common in this region of Thailand.
I have worms in me? How did I get worms?
Interesting fact, pretty much all organisms have parasites in them. However, not everyone has this worm disease. Have you been eating crustaceans recently? A way to get these worms is by eating undercooked crustaceans.
Oops, I love pickled crabs.
No worries, we will prescribe you some medicine to get these worms out of your system. Do you have any questions or concerns?
How come this sputum you said that I'm coughing up is brown?
Good question. The brown color is actually small traces of blood which would come from the parasitic infection causing inflammation or bleeding in your lungs.
Yikes.
Don't worry, we'll get you all fixed up in no time.
Our patient Andrew was infected with a parasitic disease called paragonomyces, which is caused by a trematode or fluke of the genus Paragonomus. In the United States, this may have been misdiagnosed as a form of pneumonia, because the parabronchovascular infiltrate depicted in the chest x-ray and a cough and shortness of breath are indicative of pneumonia. And parasitic infections, especially of the genus Paragonomus, are very uncommon in the United States. However, here in Thailand, there are several public domains which are frequented with parasites. Because of this, doctors implement the testing of sputum and blood tests to help indicate the presence of parasitic infections. As our amazing Dr. Adair mentioned, Andrew most likely contracted this parasite from eating undercooked crustaceans. This is how that may have happened. In water contaminated with feces containing Paragonomus eggs, these eggs can embryonate, hatch, and penetrate into local snails, intermediate hosts, where they develop from sporocytes to cercariae. Later, these parasites emerge from the snail and infect crustaceans, a second intermediate host. In the crustaceans, they turn into metacercariae. In this stage, they can infect humans, which are the definitive hosts. When the crustacean is consumed, the metacercariae exist in the human stomach and crawl through the intestines all the way to the lungs. In the lungs, parasites are adults, and they lay their eggs. Hence why poor Andrew had eggs in his sputum. Unfortunately, this parasite can actually go one step further than the lungs. If this parasite penetrates the cranium, it can cause the formation of calcified masses in the brain. These calcified masses are the evidence of tissue injury, and, in a patient with Paragonomus infections, they would most likely be indicative of a parasitic infection in the brain.